Hi, Matthew Holt with the Healthcare blog. Bit of an interesting TCB spotlight. I'm going to do a series on behalf of our friends at Transcarent, which some of you may know is not a navigator, run by Glenn Tillman, CEO and a former CEO of Allscripts and of Livongo. And we're going to go around this series and use this to spend a bit of time looking at the evolution of digital health and how things are playing out now in the overall health technology space. And really thrilled, my first guest in this series, to have Pete Hudson. Pete, we were just discussing being old guys, but Pete and I definitely OGs of the digital health scene. Pete was I believe you were an emergency room doctor in Colorado and just got fed up with people annoying you, Pete,
Right.
and asking your opinion. So you started the company called iTriage way back in the 2000s. So these days you are the managing partner at Alta Partners, which is a venture fund, and you are an investor in Transcarent, among others. But let's start with going back to the time you and I first met, which is around the early days of iTriage getting going. So, what was iTriage? What was the problem you were trying to fix back then? Tell us a little bit of that story.
Well, it's great to see you again, Matthew. It's been a long time. I remember, starting a new company and just trying to get on the Health 2.0 stage and doing everything I could to, highlight the company.
I
And
had power back then.
it was a great platform, and I think it was an exciting time because we, started to see technology solve some of the, ages-old problems of healthcare. And there's a lot of enthusiasm, a lot of great corporate interest, as well as, a great startup culture around it. So as you mentioned, I'm now managing director at Alta Partners. I invest in what we call tech-enabled healthcare services. That tends to be platforms that connect technology to service delivery and empower different ways of delivering care that couldn't be done otherwise. So either distributed care like Dispatch Health, or technology that runs specialty pharmacy claims processing and network development like Free Market Health, or platforms that are designed to provide all-in-one solutions, leveraging technology and service delivery, like Transcarent. And Transcarent is near and dear to my heart as an investor because it has so many connections to what I was trying to do in 2008 when Wayne Gare and I founded iTriage as one of the first digital health companies that was present on the App Store.
So let's dive into a bit. The problem that you told me at iTriage was that you were a doc and all your friends would say, "Hey, Pete, I've got something. My leg hurts, my neck hurts. I've got this, I've got that." That wasn't exactly what iTriage was. What did iTriage do? Let's dive into a little bit about what in 2008, which was like you said, right at the start of the App Store and the iPhone. What was iTriage trying to do?
Well, it was fun thinking about talking to you again because I went back to, that time period, and I had started a couple companies before and had sold them. So I kind of cut my teeth on using technology to create efficiencies in healthcare delivery. And the first company was a company called Numedica that was all about physician documentation and making it easier to structure documentation and hit all the items that were required from a billing standpoint, from a compliance standpoint, and from a high quality standpoint. Sold that in 2005, and I was managing a group of providers in the Denver area in emergency medicine, and I kept getting these questions from my friends who were all, educated, smart, well-insured people. I just had this happen to me. What could it be? And then, where should I go? And, there was a pretty well-established network at the time of urgent care clinics, retail clinics, emergency rooms, all the different specialties, of course, that deliver, specialist care in the Denver metro area. And yet they struggled with that. And I think the problem was if you think back to that time, and a lot of the innovators now in digital health don't remember that time because they were really young. But back then, you'd get paper network, catalogs for who's in network. You had very rudimentary website capabilities, symptom checkers, or different facility geolocation services. But none of that was portable. None of it was available and sort of high quality and focused and titrated to, the person that wanted answers right at that time of need. And I think back then we realized that people would come to the emergency room because they didn't really know the answer and they didn't have the data and the information at their fingertips. And so we said, hey, we've trained for a long time. Let's try to take some of the knowledge that we've accumulated over time and start to structure it and put it into a technology that makes it available for consumers to make better decisions. Interestingly, I think that same problem exists today, across the globe and certainly still in the United States.
Let me stop you there and ask you about that, because I mean we'll get there, I'm sure. But obviously, iTriage became part of a much bigger health plan, Aetna, which Mark Bertolini at the time was running, and had aspirations to really having a go at that problem. It didn't quite work out that way in the end. But why did we start? I mean, given that we've had this technology for so long, 2008, 2010, this sort of thing, it's now 15 years ago. Why do you think that's still such a problem today? And I think it is.
Well, I think there's, the providers of care, the payers of care, and all of the, entrenched ecosystem around care delivery are still pretty siloed. Now, to some degree, I think, they're also partners, but only to some degree. And so the technology is siloed, the integrations are tough, the data changes, doctors move around, they move in and out of network, in and out of different offices, et cetera. So, those should be simple problems to solve over time. And I think some of the work that we'll get into talking about that Transcarent is doing is targeting exactly that. Like, how do you take all of these participants in the healthcare ecosystem and really provide answers through one interface, one that's really easy for different types of people at different ages and categories, across the human spectrum, to be able to interact with that technology and get the answers they need, so that they can be well served by the healthcare system, which is obviously is built around really highly trained, highly qualified, passionate providers and care delivery organizations. But a lot of that gets messed up as people try to access. But back to 2008, I think the sentinel moment for me was July 10th of 2008. Steve Jobs announced the App Store. And so phones went from really a hardwired and maybe slightly intelligent type of device, like the handspring or the razor, some of the the early permutations, which everyone always thought I was a geek in the ER because I'd always have the latest device and be trying to figure out how to use it and get different.
You were the one guy. I was the other guy who could write on a palm with that weird language that you had to like.
Yeah, the palm
wasn't quite alphabetical. It was something, yeah.
So July 10th happens. I'm like, I've been thinking about how do patients get the knowledge that a lot of us have in the healthcare system, and then marry that to great decision-making capabilities that they could leverage anywhere, if they're on the soccer field or if they're traveling or if they're at their home, and do that with a kind of device that knows where they are and can tap into disparate databases that payers or providers may be willing to integrate with you. And so on July 11th, I sat down with a bunch of pieces of paper. I traced my phone and I started drawing what a product would look like to take somebody from a symptom all the way to the right provider to take care of the most likely types of conditions causing that symptom. And that really kicked off the beginning of a company that we built called iTriage. We raised money in January of 2009 to build the product and complete the product, start the marketing plan. And I think we launched it in March of 2009. It was one of the few healthcare apps on the App Store. And we rapidly grew to over 1 million users and a lot of health system partners. And then ultimately, Aetna was interested in partnering as a payer, and that led to an acquisition in 2011. So it was a pretty fast evolution, but there were years before where we were frustrated thinking about how do we solve this problem? And if we distilled it down to two things, it's what could I have and where should I go? And and then, that became over time, who's closest, who's available, who has the lowest wait time, who can I make an appointment with? We integrated with Epic and all sorts of different EHRs at the time. And then what will it cost based on my benefit structure? So it was a really exciting time. In retrospect, there wasn't a lot of funding going into digital health during that time. And we were the first acquisition and certainly, got a lot of great attention from Health 2.0, from, the CTO of the White House, from, the administration at that time that highlighted a lot of the concepts that we had that were empowering for patients. Could we have raised hundreds of millions of dollars to keep building off of that platform? We probably could have if we could have seen around the corner and seen, 2013, 14, 15, and certainly a pandemic that would have made a technology like that very, very valuable and instrumental for everybody, pursuing care. If I think back, what we didn't do that we really should have done is have people involved on the back end. So it was a lot of we pushed a lot of the burden on the consumer. So, what could I have? Let me look at all the different elements of the symptoms and disease categories that could be causing your problem. Let me filter through that and use some technology to help sort through that, and then marry that with navigation to the right type of provider. But we never gave anyone the ability to say, hey, I need help with this, right? I'm not really sure. And there's a couple things, some could be serious, some could be minor, help talk to me, route me to somebody, get a doctor on the phone, and then, move to video, et cetera, et cetera. So in thinking back on that gap, one, it was hard because it costs a lot. You have to have a lot of people employed and ready and available. I'm not sure at the time who pays for that kind of additional capability. Our tech was free, and we really had payment from all the different endpoints of healthcare that wanted to see certain types of patients and take care of them efficiently. So I think if we had had a couple of years, we could have figured that out. But fast forward to some of the stuff we're going to talk about today, I think people are thinking about the integration of technology, care delivery, human interaction, different endpoints where technology solves something in a great way, virtual care solves it in a great way, or in-person traditional care gets facilitated by the process, and we call that now hybrid care. And as we saw a lot of the virtual care during COVID expand and explode, I knew there would be a fallback to in-person care. You need to do physical exams, and people like the human, one-on-one interaction at times, and certainly for serious conditions. And so, Transcarent was such an exciting idea because it really involved meeting the consumer where, they want to be met across all of the continuum of different ways to interact with a care provider, from virtual to in person and beyond, like we'll talk about today.
Yeah, let's dive into that. There are two places I want to go. The first one is, so I chose to be part of a health plan. Are you who do you think? And I think this is and the answer, the question hasn't been answered. And I think some people, a lot of the huge investments in digital health, certainly in 2019, 2020 with the pandemic, and 21, where there were crazy checks being written, were thinking that this was going to be a sort of separate piece. You have a bunch of very well-established provider systems that have got bigger over the years, as you know, and obviously you've got these health plans that are consolidated over the years. Doesn't seem to be. You said, well, who's going to pay for this stuff and who's going to direct it, and how are you going to make this sort of easy consumer experience or better consumer experience work? Were you disappointed in what either health plans or mainstream providers have done over the last decade? I mean, why hasn't someone taken the kind of done essentially what you could have done with a triage had you raised a ton more money and kept it independent and pushed it forwards. Why hasn't that become kind of the standard of customer service and customer care within healthcare? That, why do we need a Transcarent? Why didn't somebody sort of figure this out before? And which organizations, kind of let us down?
Yeah, it's interesting, and it's great to have this discussion. As I look back since I exited from Aetna in 2014, I don't think I've done a single interview. And and a lot of that, there's two reasons for that. One, I had lots of time to talk about things and talk about ideas and put out my thoughts when I was running a company. I think that's extremely appropriate, and it helps the company and it helps your customers and investors, et cetera. Once I started investing, I thought, hey, if I have some theories or ideas, like I should invest against those. And putting out a white paper with an idea on what could be a good trend, that just seems counterproductive, because we have all these great LPs behind us that are looking for us to do innovative things, new things, and at times, even be a contrarian to some of the trends out there. So, your question about consolidations, a lot of these larger consolidated healthcare organizations are investors in our fund, and so we have great access to how they're thinking about things, and try to bring them into opportunities, like some of the companies we've invested in, Transcarent being one of them. I think it's still really hard. A lot of healthcare is local.
Yeah.
It's market by market. There's challenges in terms, and we've seen this recently in terms of, staffing, burnout, making sure you have high quality and constantly, adding the kind of care innovation that comes from new surgeries, new imaging studies, new laboratory capabilities, new care, vehicles within a market. To say, one of these systems is going to create a system, a technology platform or system for the country, and wire everything, I think is a long shot. They're going to participate in something they think works really well, but it's got to meet that system, in their markets with what they need to deliver the core, care that they're delivering every day. And it's really hard work. I've been on that side as a provider and worked with health systems, as a customer at Triage and other companies, as well as now investors in funds like ours. And it's really hard. What they do is hard. What payers do is hard. Probably the easiest thing payers do is collect their money before they pay it out. Like, I love those kind of businesses. But the hard thing is trying to figure out what's going to happen, over the next year, because they're really on the hook for that. And so, everybody gets caught up in their own world, I think. And so you need a couple different things to happen to create a revolutionary platform. And I'm not saying iTriage was revolutionary. It was, the first sort of in its class in the mobile space, but there was a generational change that occurred. We went from, and I was in the Bay Area during Netscape going public in '94. And I remember walking down the street, going to get coffee before I went to go do an ER shift. And I was like, everything's changed. We now have access to an unlimited amount of resources. And that led to, 5+ years of intense innovation in the Bay Area. And so, in 2008, when I saw the App Store happen, I really believed in my heart of hearts that this was going to be the next evolution. And at the time, there were 5 million iPhones out there. So we were building a technology for 5 million phones. Now, how many billions of phones are there? So being able to recognize some of those changes, those are generational changes. And I think the next generational change we're starting to see is AI.
Well, let's dive into that, because you mentioned what was wrong, what didn't happen with iTriage, right? Was didn't have the kind of human backup. The promise of AI, and obviously you looked into this a lot, is that essentially, the machine becomes the human backup. You get the intelligent companion. It's not an accident, I think, that ChatGPT-O and the wayfinding from Transcarent were announced pretty much on the same day, I think. You're starting to see the idea that the science fiction idea of the intelligent computer being able to manage and help you is really starting to come through. Uh, how do you think where do you see that going within healthcare? We should say briefly that for the people who are watching who don't know that the wayfinding tool is essentially uh, an AI assistant that sort of lives behind Transcarent, but also Transcarent has got online primary care, where the acquisition they had, and they've got access to specialty care and cancer care and concierge services. There's a bunch of other stuff's in there, and diet, and there's a bunch of other services in there. But really, it's how do you see the AI tool, either a Transcarent or in general, sort of pulling all this stuff together to get over that problem you said where people need a bit more help?
Yeah, I think we invest in platforms. There's been so many dollars that have gone into point solutions out there. And at one point I went through PitchBook because I was like, what am I missing? There's been $17 billion or whatever going into digital health. Am I just dumb and I've missed all these opportunities, or do people not like me and they don't want to call me to co-invest with them? That the latter is probably, quite true, but
That may not be fixable.
yeah. I have more work to do there. But I looked through, something like 2,300 deals and went through all of their, stated areas of focus. And I whittled that down to something like 70 deals. We were in a bunch of those deals and then whittled it down further based on, groups that I knew or had experience working with. And it came down to about 16 deals. And so, there haven't been that many ambitious platforms put together that have the sort of the institutional knowledge of what's wrong, what the problem really is, and how to fix it, and have leadership that has gone through multiple cycles of build, grow, sell, that understands how you build something of value in this space. And so, when Glenn called me about this new idea he had, and really an evolution from previous companies where he was only able to do a part of the problem, and he kept being asked by customers, "Can you solve more of the problem? Can you solve the whole problem for me?" That piqued our interest. If you ever had used iTriage and knew sort of how we saw the world back then, it was really, how do we solve everything? How do we have an answer wherever you are in your clinical journey, as well as your, whatever geography you happen to be in. And so when Glenn had this idea and vision of, let's create a platform that can handle, anything that anyone has clinically, administratively, from a benefit structure standpoint, as an employee, let's put that together and let's do that in a way that leverages some of the experiences that you had with iTriage, thinking about how consumers think about healthcare. Because personally, and I've said it before, the only thing that ever goes viral in healthcare is a virus. And that was like
We have one of those.
2015 quote, and then it came true.
Right.
And so, healthcare technology and solutions have to be easy to use. They have to be present and relevant at the time of need. And then they have to solve your problem in the way that you want your problem solved. And that the way you want your problem solved has evolved in a lot of great ways across the country. We were fighting the battle of how do you get people to use iPhones, and how do you get people to use Android phones instead of going to the web or calling a friend or calling a call center, et cetera. And now a lot of that's wired, right? So there's been generational changes across all of the constituents that you need to create a successful solution like Transcarent. Doctors now, for 16 years, right? Which is, I don't know how many generations of doctors that includes, now understand technology. They all document online, through their EHRs. They all use mobile devices. They're all comfortable with text, et cetera. Patients all have phones, right? It doesn't matter if you're Medicare, if you're Medicaid, if you're young or old, you have a phone and you know how to use it. Technology, through the mobile generational change that occurred in the mid 2000s, has now gone to a place where AI is the next generational change that we'll get more into in this discussion. But that's an important technology wave that is really instrumental for getting technology utilized, but also, creating great companies that grow quickly in the innovation space. And then I think the last thing is leadership. As I alluded to before, there's been generational change in leadership. Digital health has had people that have grown companies, raised money, sold them, and now are back for their second or third iteration, and they've had success stories. You look at Glenn Tallman in particular there, and there's plenty of others out there. So as an investor, thinking about who do you work with, who understands the life cycle of possibilities here, and then you match that with a generational change in doctors, patients, and new technology. It's a great confluence of a bunch of different trends.